Hey everyone, this is Dr. Philip Cordova and Dr. Brian Brown for Facebook Live here on this beautiful Houston day. We were talking, trying to figure out what we were going to chat about today, and we were talking about some of our favorite patient stories. The stories either that surprised us or the ones that motivate us to really keep doing what we're doing. And I was thinking about, we share this in our class. We do this class every Tuesday night, and we share this story. It's a 2-month-old little boy that came in. His mom brought him in with his 2 little sisters in tow. Their ages, they were probably like 3 and 2 years old. They were scared to death of their little brother. And they were scared because for the last 2 months, this little boy had not stopped crying unless he was asleep. And so she wasn't really sure what to do with him. She had already taken him into the medical doctor who had diagnosed acid reflux, and that wasn't working. I mean, he was still just crying and crying. And it was only because a lady at a grocery store walked by her and said, "You should take that kid to see a chiropractor," that she decided to give it a try. So she brought in this little boy. She was all disheveled, her hair's not brushed, no makeup on. She's kind of like, "Here, take this kid, do something with him, make him stop crying." And I laid him on the table, and he immediately started turning his head off to one side, and I would bring him back. He was turned his head back again. And what I felt for was a tiny misalignment right here at that very first vertebrae called your atlas, which is not uncommon that newborns will have a misalignment in that area, just simply from the doctor pulling them out, that they'll get a subluxation up in that area. So I just took my finger and applied a little bit of pressure and told her to bring him back the next day. So the next day she brings in the little boy, still crying, but she said he was consolable that night, which meant when she picked him up, he would lower the volume just a little bit and stop crying quite as much. So then I adjusted him again and told her to come back again the next day. And so the next day, it was like a totally different family, where her hair was brushed. You could tell she got some sleep. The little girls were like, playing with his toes and talking to him. And he did something that day that he had not done in his 2 months of life. He smiled. And so that's one of those stories where, people go, well, I don't know if I believe in chiropractic. I think back, that little boy did not believe in chiropractic at all. I mean, he didn't really believe in anything, right?
You're talking about a 2-month-old.
Right, he's 2 months old. So
wow.
So he had no belief in chiropractic, but he still managed to get better. And so that's the fun part. So that's one of my favorite patient stories.
So, man, awesome story. And that's touching because, like you said, 2-month-old, and mom wasn't a patient of ours.
No, she wasn't a patient at all, yeah.
So, and if that lady would have never told her in the grocery store, like, try chiropractic, and what would have happened? Wow, that's an awesome story. So one of mine was a guy who walked in. He was in his mid-30s, and he walked in hunched over and could not stand up straight. And that was a job. It was adjustment after adjustment, and I told him, just keep your spirits high. This will work. You have a chiropractic issue. You have a structural issue. His back was, when we took an x-ray and we took a side view, it was literally curved the wrong way. And it was not just him standing forward. It was his back was stuck that way. If he was to lean backwards, it would still be curved the wrong way. And it was causing so much pain. And being in your early 30s or mid-30s, come on, you don't want to be that way. You can't work that way. You can't do anything. You can't work out. He was very active and was wondering how he got that way. So we got to the cause of the problem and started adjusting. It didn't work overnight. It didn't happen overnight. A lot of people want to think that these things get better overnight, but they don't. But he kept at it, and eventually, week after week, he was getting straighter until he was running in here, running out. He was exercising how he wanted to, and it was just a tremendous turnover. And just the smile on his face after just realizing how much better he felt and how he walked in with so much pain, and just knowing when we did a re-exam how all of those tests that were positive and that would cause so much pain they were all gone. And his life is so much better now.
And we see that a lot where, he probably was starting to give up hope, right?
Yeah, he was, yeah.
But since we see it all the time, since we see patients get better, I mean, for us, it's not new. I mean, we'll see somebody come in with a certain amount of symptoms or a curve in their back, and we know, we can see the path. We can see what it's going to take to get them better. We can see how much better they're going to be if they'll just stick with it and do it. By that same token, we don't always take every patient, because we also see those same patients that we go, you know what, this probably isn't the best place for you.
Yeah.
But it's fun when it works, And I had another patient, her name's Stephanie. She had a lot of headaches her whole life. I mean, every single week she had headaches as long as she could remember. She said that she could not remember a time when she did not have headaches.
Wow.
And she didn't come in with for headaches. That was the funny part. She came in because she had the typical sitting at a computer, neck pain, upper back pain. But we just started working on it, and it just almost, as a matter of fact, she said, "Oh, and I have headaches every day, but that's normal." And so I said, they're not normal. They're very common, but they're not normal. And it was only a couple weeks of adjustments where she really started to notice the change, and she came in for the first time saying, "I didn't have a headache this week." And then the next week she did, but it was like less intense. And after a couple of months, she no longer had headaches. And for her, it was just one of those things where she had just kind of accepted that was how her life was going to be. The headaches were just going to be a natural part of that. And I remember her saying, I just thought I was always going to have headaches.
Man.
That she had just gotten so used to that for her it was life-changing to have that. She still comes in for regular care, and that's the same thing. She comes in once a month, and she'll report, no headaches this month, or I had one mild one day, but I'll take it, And but to see the changes with her, headaches are one of my favorite things to help patients.
I'm the same way. I had one. Her name Dorothy. So she 20 years of headaches, and never been a chiropractor. She was taking every medication under the sun that they were just prescribing and trying to try this, now try this one, and nothing was working. Botox shots every 3 months. She was driving all the way to Austin to get them, and they've been calling her down in Austin to see where she's been, because now that she's come in, we got to the root of the cause of those headaches. We've been adjusting her neck, and her headaches are gone. She get them every now and then, but after 20 years of headaches every day, and you get them once a month, once every couple of weeks, that's a huge improvement. And the chiropractic, she's no longer on any of those medications that's poisoning her pretty much and not doing anything. So
right. Because headaches aren't caused by an aspirin deficiency. That's the old joke. I mean, she just doesn't have a lack of those chemicals in her body. Something is wrong. And getting to the root of it has been the main thing to help. And we love seeing those stories too, because somebody comes in with a bad back, they kind of expect to get better because they're at a chiropractor for that, and they get a lot of sympathy, right? They get, "Oh, your back's bad. Oh, that's the worst. Oh, try this." But somebody with headaches, they don't get a lot of sympathy. People just think they're in a bad mood. They just think, "Oh, they need to get over it." They don't. They can't quite understand exactly what's wrong. They can't understand, that the people don't relate to it as much because they just can't quite wrap their head around the idea that this person's not just in a bad mood, that they actually have a headache, right?
And then so many people think it's normal. Like it's not a normal thing. Just because everybody in the office has headaches doesn't mean that it's normal. Yeah, it's normal in that office because maybe they're not coming to a chiropractor, but it's not a normal thing. You shouldn't have to go through that.
Right. So we're happy to help. Do you have another one you want to share?
I'm good.
You're good? Yeah. All right. Well, we appreciate you joining us here for Facebook Live. Feel free to message us. If you have any questions, we're happy to answer those. If you have a topic that you would love for us to discuss, we're still always looking for it. We kind of pull from whatever's happening in the office this week. But you heard some great patient stories today of why patients or why kids should get adjusted, why people with headaches should get adjusted, and why you should not give up on your problem. That a lot of times there is a fix. You just have to